Welcome to the 5-Minute Drill Down. I'm Dr. Phil Klein. First, a quick shout out to our sponsor, SDI, the makers of Rivastar Aqua, a next-generation water-based silver fluoride solution. There aren't many things in dentistry that let you stop decay with no drilling, no anesthesia, and minimal chair time. But Silver Diamine Fluoride, or SDF, is one of them. For dentists who prioritize preserving tooth structure, it's quickly becoming an essential tool. In the United States, Silver Diamine Fluoride is primarily registered for use as a desensitizing agent. However, internationally, it is widely used off-label for several additional indications, most notably the arrest of dental caries. So what exactly is SDF? It's a clear liquid in a small bottle with two ingredients. First, silver, which fights the bacteria that cause decay, and second, fluoride, which helps rebuild and strengthen teeth. Together, they deliver a 1-2 punch that stops decay in its tracks and keeps fighting it over time. So how does it actually work? Silver ions kill decay-causing bacteria and reduce acid production. Fluoride ions integrate into the tooth, forming fluorapatite crystals that resist acid and promote remineralization. SDF also protects dentin collagen and deposits minerals like silver phosphate and calcium fluoride. This hardens the lesion and occludes dentinal tubules, protecting the pulp and dramatically reducing sensitivity. And the best part? SDF stays active in the tooth, suppressing bacteria for years, a phenomenon known as the zombie effect. And here's what patients and dentists really appreciate. No drilling, no anesthesia, just a microbrush and a few seconds of your time. So who's SDF for? It's a game changer for kids with early childhood caries, for elderly patients with root caries, and for medically compromised patients, or anyone who can't tolerate traditional restorative care. It's especially effective in community clinics, public health settings, and mobile dentistry. And increasingly, general dentists are using it as a first-line approach, treating decay medically before ever picking up the handpiece. Let's weigh the pros and cons. On the plus side, SDF is minimally invasive, cost-effective, and low stress for patients. No sedation, no fear. And it often helps grow your practice through word of mouth. The only downside? It stains decay black. But that discoloration signals it's working. Arrested decay is a far better alternative to drilling away remineralizable tooth structure. And if staining is a concern, especially in the aesthetic zone, Rivastar Aqua by SDI offers a practical solution. It incorporates a simple second step, the application of potassium iodide. This significantly reduces the free silver ions responsible for dark discoloration. Now, if decay has reached the pulp or there's an active infection, SDF isn't the answer. In those cases, traditional treatments like endo or extraction may be necessary. So what are the clinical steps? First, remove only the soft, infected dentin, the mush, using a microbrush. Remember, the leathery dentin beneath is capable of being remineralized and should be preserved. I recently interviewed Dr. John Fricella, an expert on SDF, and he shared an important insight.
Don't ever remove beyond that leathery dentin. And dentists love to pick at that stuff, and it comes off like layers of an onion, and then all of a sudden you're looking at a bleeding pulp. Don't touch that stuff. Once you're down to the leathery dentin, that's remineralizable tooth material indigenous to the patient. Leave it alone.
Once the mush is removed, apply a thin layer of SDF with a microbrush. Let it dry, and ideally give it a few days to react. On return visits, restore the tooth. Glass ionomer is often the best choice due to its chemical bond, fluoride release, and aesthetic potential. Other options include resin-modified glass ionomer or composite. In medicine, doctors treat patients medically before performing surgery. The same should apply to our profession. SDF is a powerful tool for the medical management of dental caries, especially in high-risk patients, children, the elderly, and those who can't tolerate drilling. Pair it with glass ionomer, follow the proper protocol, and you can arrest decay, restore function, and protect the tooth, often without ever reaching for your handpiece. Once again, many thanks to our sponsor SDI. To learn more on Revastor Aqua and the entire SDI product line, visit sdi.com.au. And I hope you join me on the Dr. Phil Klein Dental Podcast Show. We drop a new episode every Monday and Thursday on Spotify and Apple Podcasts, featuring conversations with the top clinicians and educators in dentistry. There's always something new to learn. I'm Dr. Phil Klein. Thanks for watching.